Diabetic nephropathy is a renal disease. Look at this picture, shows that protein in urine, diabetic nephropathy kidney and healthy kidney. Look at this, and MRI findings. Detail going on. Introduction. A diabetic nephropathy, also known as diabetic kidney disease, is one of the most severe complications of diabetes mellitus, primarily affecting the kidneys. It is a progressive disorder that leads to kidney damage, manifesting as proteinuria, a decline in kidney function, and can eventually result in end stage renal disease, ESRD. Definition. Diabetes nephropathy is a kidney disease that occurs in people with diabetes due to long-term damage to the kidneys, blood vessels, leading to the kidney's inability to filter waste products efficiently. Types. 1. Microalbuminuria, early stage where small amount of albumin or protein are found in the urine. 2. Macroalbuminuria, advanced stage where urinary extraction of albumin increases significantly, indicating worsening kidney damage. Causes. Prolonged hyperglycemia. 2. Hypertension, high blood pressure. 3. Insulin resistance. 4. Dyslipidemia. 5. Oxidative stress. 6. Advanced glycation end product. 7. Genetic predisposition. 8. Smoking. 9. Obesity. 10. Poor diabetes management. Risk factors. 1. Poor controlled diabetes. Chronic high blood sugar levels accelerate kidney damage. 2. Hypertension, increased stress on the kidneys. 3. Duration of diabetes. The longer a person has diabetes, the greater the risk. 4. Obesity associated with insulin resistance and metabolic stress. 5. Smoking can exacerbate vascular damage. 6. Family history. A family history of diabetes nephropathy increase the risk. 7. Ethnicity. African Americans, Hispanics and Native Americans are at high risk. Complications. 1. End stage renal disease, the final stage of kidney failure requiring dialysis or kidney transplantation. 2. Cardiovascular disease, increase the risk of heart attack, stroke, peripheral vascular disease. Three, hypertension worsen as kidney function declines. 4, fluid retention leading to swelling, edema in the lymphs and around the eyes. 5, electrolyte imbalance, particularly elevated potassium levels. 6, anemia due to reduced erythropoietin production by the kidneys. Pathophysiology. The pathophysiology of diabetic nephropathy involves a complex sequence of events resulting from prolonged hyperglycemia in people with diabetes. Here is step-by-step breakdown. 1. Prolonged hyperglycemia, high blood sugar levels. 2. Glomerular hyperfiltration, initial stage. 3. Thickening of the glomerular basement membrane. 4. Mesangial cell expansion and matrix accumulation. 6. Tubulointestinal fibrosis. 7. Progression to proteinuria. 8. Decreased glomerular filtration rate. 9. End stage renal disease. The stepwise progression reflects the chronic nature of diabetic nephropathy and highlights the importance of early detection and management to slow down the disease process. Signs and symptoms. 1. Early stage, often asymptomatic. 2. Proteinuria, presence of albumin in the urine is an early sign. 3. Edema, swelling in the feet, ankles, hands or around the eyes. 4. Fatigue, a kidney function declines, waste products accumulates in the body. 5. Nausea, vomiting due to build up toxins. 6. Shortness of breath resulting from fluid overload or anemia. 7. Hypertension, high blood pressure may worsen or develop. Diagnosis. A urine test. 1. Microalbuminuria and macroalbuminuria tests are key to detecting kidney damage early. 2. Urinary albumin to creatinine ratio is used to quantify proteinuria. B. Blood test. 1. Serum creatinine and glomerular filtration rate measure kidney function. 2. Blood urea nitrogen evaluate waste product levels in the blood. C. Imaging. Ultrasound or MRI may be used to assess kidney size and structure. D. Biopsy. In some cases, a kidney biopsy is performed. to confirm the diagnosis and assess the degree of damage. Nursing diagnosis: 1. Excess fluid volume related to impaired kidney function. 2. Imbalanced nutrition related to restricted dietary intake and poor appetite. 3. Risk for infection related to altered immune response due to kidney functions. 4. Fatigue related to anemia and electrolyte imbalance. 5. Risk for ineffective renal perfusion related to diabetic nephropathy progression. Management and treatments: 1. Glycemic control, maintaining blood sugar levels close to normal through medications, insulin or oral hypoglycemic agents. A diet: low sugar and low carbohydrate diets. And lifestyle modifications, exercise and weight management. To blood pressure control, achieving target blood pressure using ACE inhibitors or ARBs to reduce proteinuria, a slow disease progression. 3. Lipid control, statins to reduce cholesterol and decrease cardiovascular risk. 4. Dietary modifications. Low sodium diet helps manage hypertension and fluid retention. Protein restriction may reduce proteinuria and slow kidney damage. 5. Dialysis. In advanced cases, hemodialysis or peritoneal dialysis is required to manage ESRD. 6. Kidney transplantation for patients with ESRD who are candidates for surgery. Psychosocial medicine. Diabetic nephropathy can significantly impact a patient's psychological and emotional well-being. 1. Depression and anxiety results from the chronic nature of the disease and the stress managing it. 2. Body image concerns related to physical changes, especially during dialysis. 3. Support systems, importance of family, peers and professional support in coping with disease. Prevention: 1. Tight glycemic control, regular monitoring of blood glucose levels and HbA1c. 2. Blood pressure management, maintaining target blood pressure. 3. Regular screening, annual microalbuminuria test for diabetes patients. For healthy lifestyle, including regular physical activity, smoking cessation and maintaining a healthy weight. 5. Medication adherence, regular use of prescribed medications like ACE inhibitors, ARB, and statins. In conclusion, diabetic nephropathy is a serious complication of diabetes leading to significant morbidity and mortality. Early detection, proper glycemic control, blood pressure management, and lifestyle changes can slow its progression. Managing the psychosocial aspects of the disease is also crucial in improving the quality of life for affected individuals. Thank you. Have a nice day.